So unfortunately, there's no specific known treatment for coronavirus, including SARS and MERS or this novel coronavirus. So it's really about supporting the patient. So if somebody with any infection, there's likely to be a range of symptoms that a person has. People may be mildly unwell and may not need to be in hospital at all, but they certainly need to be isolated from other people while they're infectious. But some people on the other end of the spectrum will be very sick with lung disease, pneumonia and so on, and may need even intensive care treatment. So like many infections, there's a range of disease, often dependent on the dose of infection you get, but also your underlying health. If you have underlying previous conditions and your age, often we see with SARS and other coronaviruses, the older you are, the more likely you are to have more severe disease.
Right. Just one more follow-up, Jeremy, and I think this is pretty much from an academic perspective that one would want to understand how much research has been done in terms of finding an antidote to the virus or an antiviral drug or a vaccine. So far, we're given to understand that some research is happening in the US regarding this, and the fact that this virus comes from the same family as SARS and MERS would give some background to actually finding a solution sooner rather than later.
Look, I'm not an expert in the research area, but I know that with MERS and with SARS, there has been a lot of interest in trying to develop preventive vaccines, which would be fantastic to be able to prevent this. But at present, there is no vaccine for any of those coronaviruses. And as we talked about before, no specific treatments. So the measures that in fact worked very successfully for SARS, which was a similar family of coronaviruses, this novel coronavirus, was kind of good old-fashioned public health. So good hygiene, so if people have symptoms, to call to their doctor ahead, making sure they're getting medical attention early so that they can then also be diagnosed, but importantly isolated so they're not infecting other people. And that's a really important thing. Good hygiene measures such as covering your coughs and sneeze with a tissue, washing your hands thoroughly with soap and running water for at least 20 seconds. If you don't have a tissue, coughing into your elbow, and keeping away from other people, so that the key to these sorts of infections is preventing transmission by separating the sick person from well people so that transmission doesn't occur.
Hi, I'm Emily Tan, and thanks for watching CNBC. You can check out more of our videos by clicking on the boxes on the screen, and don't forget to subscribe to the channel for more. Thanks for watching.